I'm Devin Marshall, and today's presentation will be on influenza. What is influenza? It's a highly contagious viral infection that has multiple strains that infect humans and animals. If left untreated, the disease has potential to cause serious illness, hospitalizations, and death, especially in those considered high risk. Pandemic history. There were four major pandemics, with the first one being in 1918, causing about 20 million deaths. The next one in 1957, causing about 1 million deaths. The next one in 1968, causing about 1 million deaths. And then the most recent one in 2009, causing about 12,000 deaths. The impact of these pandemics was the development of vaccines. And then by the late 1990s and early 2000s, response plans were developed to prevent future influenza pandemics. And then health officials eventually began recommending people get annual vaccines as they're most effective against these influenza pandemics. Overview of the virus. There are four types of the virus. Types A, C, and D infect animals. Type A causes disease in birds and mammals. Type C causes disease in pigs and dogs. Type D causes disease in cattle, but researchers are unsure whether this type can cause disease in humans. And then types B and C infect humans. Diagnostic tests. All tests can detect both influenza A and B, but provide results at different times. The tests with the highest accuracy are molecular assays, rapid molecular assays, virus cultures, and then the ones with moderate to low accuracy are immunofluorescent assays, rapid antigen tests, and that's about it. As for seasonal influenza, types A and B cause worldwide epidemics. Transmission occurs through small airborne droplets at short range. A person diagnosed with the virus may not show any symptoms. And when symptoms do occur, systematic and respiratory symptoms occur simultaneously. So fever, chills, myalgia, headaches are accompanied by dry cough, sore throat, and nasal discharge. Symptoms in older adults include malaise, anorexia, dizziness, and weakness without other symptoms like fever, sore throat, and myalgia. Symptoms in children include nausea, vomiting, diarrhea, and abdominal pain. Public health prevention strategies. Um, the use of non-pharmaceutical interventions are effective. So, like isolation, the use of masks, dining and travel restrictions, social distancing measures are all effective against the spread of influenza, but consistent enforcement is needed in order for them to be effective. As for healthcare facilities or just the healthcare field, environmental and source controls are effective against the spread of the virus. So, using ventilation, personal protection equipment, proper hygiene, and etiquette, those procedures prevent the spread of influenza by reducing contact and room contamination. Moving on to vaccines and antigenic shift and drift. Sorry, I might pronounce that word a couple different ways. But moving on. So starting with antigenic drift, that refers to the small changes that occur slowly and make the virus just different enough that the immune system does not fully recognize it. And then the shift refers to the big changes that happen suddenly when two viruses infect the same cell and mix their genetic material to create a new virus that the immune system hasn't experienced before. And then this shift leads to pandemics. As for vaccines, there's four types. Um, and these vaccines contain two strains of type A and then one strain of type B. And then the efficacy of these vaccines is based on factors like vaccine strain matching, age, and health status. And then annual vaccines are critical to reducing seasonal influenza spread. So starting with inactivated vaccines, Those contain killed virus particles and are suitable for people aged 6 months and older and are administered intramuscularly. And then live attenuated vaccines contain a live virus that cannot cause illness in healthy individuals, and it's suitable for people that are aged 2 through 49, excluding pregnant and immunocompromised people. And that's administered as a nasal spray. Recombinant vaccines, they're produced without the actual virus, and those are for people that are allergic to eggs, and that's injected. Adjuvanted and high dose vaccines, those include higher antigen doses to boost immune response, and they're usually designed for older people age 65 and older, administered intramuscularly. Treatment, there are two types of antiviral medications used to treat influenza. Um, Neuraminidase inhibitors and polymerase acidic endonuclease inhibitors. They alleviate symptoms, prevent severe complications, and shorten the duration of the illness. Um, Early diagnosis and treatment is essential to the efficacy of the treatment, and it is recommended people who are infected go get treatment as soon as symptoms start to happen. Um, there are three neuraminidase inhibitors, oseltamivir, zanamivir, and peramivir. And then there's only one polymerase acidic endonuclease inhibitor, um, marloxavir, marboxil. Moving on to the importance of research, it's critical due to its global prevalence, well, the global prevalence of influenza and just the significant health and economic impacts that it has due to its rapidly evolving nature. Um, and we know influenza causes severe respiratory complications, hospitalizations, and deaths. And then children, older people, and pregnant people are vulnerable to these outcomes. Um, And then, like, due to antigenic shift and drift, the research can lead to an understanding of how the virus goes from animals to humans. And then we can understand, or I mean, that will result in the new strains being stopped before it can cause widespread illness. And then also, antiviral treatments are susceptible to antiviral resistance. And then vaccines don't offer complete protection due to the mismatching of circulating strains. That's why it's so important to strain match. Um, but research is important for vaccines because we could create a universal vaccine and possibly a new antiviral medication that will overcome resistance. And then investing research into the virus would address the problems directly, and it will strengthen our global readiness for other infectious diseases. And that's my presentation.